So, good evening, everybody, and I say I'm Joan Kehoe, and I also do Stomacare in the MAT as well, and Mary touched on that subject. Okay, so I'm going to speak this evening about the National Bowel Cancer Screening Programme, which has been launched last November. So just to raise awareness of it, and especially seeing as April is Bowel Cancer Awareness Month. So an overview. So what we're going to speak about is what is the National Cancer Screening Service, what is bowel cancer screening, the benefits of it, why would we bother with it unless it was beneficial, the population that it is targeting, how this will be implemented, what it actually involves, follow up the ethical issues, and and then very importantly then our take-home message. So the National Cancer Screening Service, in 2006, the strategy for cancer control in Ireland was launched, and that was just a comprehensive overview of how cancer was being managed in Ireland, treated, diagnosed and detected. And then in 2007, on foot of that report, the National Cancer Screening Service was set up, and that's concerned with screening cancers, and so that they can be detected at an earlier stage, and they're much more amenable to treatment when they're caught at an early stage. And also we now have the National Cancer Control Programme, which is also coordinating all the different cancer centres, and they are reviewing how we treat our cancers here in Ireland, as well as kind of taken over from the cancer control. That was my understanding of it. So at the minute we have breast cancer screening, we have cervical cancer screening, and we have diabetic retina screening that comes in underneath the cancer screening as well. And other areas are being looked at currently, like bladder and genetic factors as well. They're being looked at to see how all that can be improved. So a lot of work is being done in that field, which is brilliant. So what is bowel cancer screening? So bowel cancer screening aims to detect bowel cancer in people with no symptoms, when treatment is more likely to be effective. And it does not diagnose bowel cancer, because the test that is used to send you on for further tests diagnoses microscopic amounts of blood in your stool. And as Mary said, that it gets mixed in with the stool on the way around, but there's many other conditions that can cause that as well. And the purpose of the whole programme is risk reduction, and it can also detect benign polyps, which many people will have, and that nothing ever happens to them, they just stay benign, and these are easily removed during a colonoscopy procedure. And these polyps, some polyps can develop into cancer over time, and it's great if you can get them at an early stage before they do develop into a cancer. The benefits of the bowel cancer screening, I just looked to other areas and countries who have a bowel cancer screening program in place. And with the National Cancer Institute in America states that regular bowel cancer screening has shown to reduce the risk of dying from bowel cancer. And also the US Department of Health and Human Services say that routine screening can reduce colorectal cancer deaths by up to 60%. And also in England, they have their bowel cancer screening program. It's fully up and running now since 2010, and it's targeting 60 to 74-year-olds, as Mary said in her lecture, that 65 upwards, your chance of getting, as with many other cancers as well, increases. So that's why that population is targeted. And it's predicted that they will save about 2,000 lives a year by year 2025, and that's a large study by Parkin. Some statistics, Mary did the statistics as well. It's the most frequently diagnosed cancer in both men and women. And we have breast singular for women, and we have prostate for men, but it's the one that affects both genders. And roughly 2,000 cases diagnosed annually. And by 2020, they reckon that there will be a huge increase, up to 79% for men and 58% in women. And this is largely due to an aging population. And with the screening coming on board now, a lot more cancers will be detected initially, but then that should taper off as people move through the screening process. We have one of the highest incidence in Western Europe. We have a high mortality for men in Western Europe compared to other countries, but then a lot of those countries have screening in as well. And some areas, Cork City and County, the East Coast, Wexford and Waterford, they seem to have some areas have higher incidence of colorectal cancer. So I'm from Wexford, live on the East Coast, so not looking, so hopefully I'll be in the screening programme soon. So Tala Hospital, the Adelaide Meath and the National Children's Hospital in Tala, they had a pilot bowel cancer screening programme going there for 2 years, and their target population was 10,000 people. And they did the 50 to 74-year-olds just to increase the numbers. And in year one, 51% participated, more women than men participated, and as Mary said, that is common. Of the 5,063 who participated, 10% had a positive test, which is, I'll go on to tell you what the test is about. It's FIT, which is fecal immunochemistry test, which is the test that's done on the bowel sample, on the stool sample. So of that 10%, 419 went on to have colonoscopies, and 154 precancerous polyps were detected, and 38 cancers were detected. So just goes to show that it is worthwhile, and that's a large study. McNamara et al. Did that. How it's being implemented. It's being implemented on a phased basis, and this allows the capacity to cater for the full age group. So all measures and checks will be in place just to ensure that everything is being done correctly, and then it'll be rolled out then to other age groups. And it's going to take roughly 3 years for the first phase to be implemented. And it has commenced in Wexford and Kilkenny and regions since November 2012. So suppose you have to start somewhere. And so Wexford and Kilkenny. Desired uptake is 50 to 60%, and that is in keeping with international standards and other screening programs internationally. There will be a 2-year callback, so as you move through it, every second year you'll be called back then for another test, and then another test until you go out the other end of it. They're employing 20 advanced nurse practitioners, and they will be trained to perform colonoscopies, plus they will be doing a lot of the other coordinating and the nursing job duties there. And there's 15 accredited screening hospitals at the minute, the endoscopy units attached to the hospitals. And in Dublin we have Blanchardstown, James Conway Memorial Hospital, we have St Vincent's Hospital, we have St James's, and we have Tala, the Adelaide Meath National Children's Hospital. And it is reckoned it'll take about €6.5 million to implement and get it up and going. These are the 15 centres, and 4 in Dublin, all around the country there, and they reckon nobody will be more than 80 kilometres away from their nearest centre. So the target population, it's population based, so that means everybody in Ireland is eligible, and regardless of no discrimination at all, men and women. So they reckon there'll be about 750,000 people plus in the system. It's targeted for people with no symptoms, because the symptomatic people should be visiting their GP and not wait for the bowel cancer screening to take place, or visit their area or come into their area. And that's very important, that if you have the symptoms, you go to your GP and don't wait for the bowel cancer screening programme. Initially it's for 60 to 69-year-old people, and it eventually will be 55 to 74 when the full rollout. The invitation, so how will you be captured? The Department of Social Protection has nearly everybody's details there. And if you are worried that you're not on it, there is a free phone line that you can ring, and I'll give you that at the end. You'll be sent a letter of invitation to participate in the programme, and you reply to the free phone number with either yes or no, and then you get, there's no obligation on you to do it whatsoever, it's totally voluntary. If you don't reply to it, you will be re-invited within 8 weeks, usually, if there's no response. So just a reminder in case the letter got mixed up or whatever. And if you don't respond after that, I think they leave it. And this is how you consent. So you have to consent to the procedure. You consent by phoning the free phone number. You can also opt out. So if you decide to take it up and then sort of a few months down the road say, oh no, I don't want this, so you can always opt out and just ring and cancel your consent. You will receive a letter and a kit then once you consent, and it's in your area within 5 working days. And reminder, if the sample then is not returned to the centre within 4 weeks of it being dispatched to you, you will get another reminder. Then also, if some of the kits, if they're sent back and they're unacceptable, which can be due to damage in the post, they're just not done properly, or the test can't be done on them, you'll be issued with a repeat kit. So it seems to be very comprehensive there. The test contains a letter of invitation and instructions, and it's there. A plastic bag with a click lock or ziplock lock on it, and that will have a label on it with your barcode, and you must date that the day you take your sample. So this is your sample pot, and that's barcode with your details on it, and there's a little applicator in that attached to the lid of the little jar, and you have to take your sample of your bowel motion with that little applicator. I'll go through that, and then you secure it and put it into your Ziploc plastic bag and into your prepaid, pre-addressed envelope, and you send it away. It has to be sent away within 7 days of taking the sample, and that's another reason why it can be sent back to you if the time frame is too long between taking the sample and receipt of it. Doing the test, so read the instructions very carefully and follow them very carefully. They're very comprehensive and foolproof. You know, you shouldn't really make any mistakes with it. You take the sample, it's done in the privacy of your own home, so that's the great thing about it. You don't have to go to a GP clinic, or you don't have to go to a unit to have it done. So however you collect your bowel motion is your own business, because it's in the privacy of your own home. It's okay if it's contaminated with urine in the toilet bowl, and that doesn't affect it, the test. So just ensure you date and send off the sample as instructed in the prepaid addressed envelope. Post the sample within 7 days of taking it, and your results will be received within 4 weeks. Accuracy of the test, as with a lot of tests, it's not 100% reliable. Internationally peer-reviewed in 2011, so there's a committee set up just to govern all of this, and many stakeholders in it, and so they got international peer-reviewed, and the FIT test was the most suitable, and Ireland is one of the first countries to use the FIT test. Other countries use a different test, I won't go into that, and so the FIT is the one that's being used in Ireland, which is the fecal immunochemical test. And what that looks for, microscopic traces of blood in your stool that can be a precursor to, can be caused by a cancer, but also can be caused by other benign conditions that Mary went through. And it checks for microscopic blood. And not all cancers, polyps bleed all the time, so that's why there's a 2-year callback. And changes can occur as well within the 2-year intervals. That's why it's important, if you're having symptoms, that you visit your GP. You don't wait for the bowel cancer screening, or you say, oh goodness, I was screened there last month and I'm okay, nothing can go wrong, and I'll wait for the next one. But if you are having symptoms, regardless of when you're in the screening program, be sure to go and get them looked at. And if you experience any, I have that there, yeah. So this is what a polyp looks like. I hope it comes out okay. As you can see, it has a base on it there, so that's very easily removed at colonoscopy, and both of them there, and that will be sent off to the lab and analysed, and if that comes back as nothing in it, that's perfect. You are back into the screening programme, no further treatment needed. So that's what we're looking for in the screening programmes, to get everything much earlier so that it's much more treatable. The results, you will receive the results within 4 weeks, and 94% will be normal, so they will just go back into the callback, and not normal 6% they reckon will be not normal, but those figures will all improve as people move through the cancer screening program, because the cancers will be diagnosed at a much earlier stage. So there'll be 6% will go for colonoscopy, and you'll be off the colonoscopy date usually within 4 weeks if you are deemed clinically suitable. So anyone going for a colonoscopy will have to be pre-assessed to make sure that you're clinically suitable to go for your colonoscopy. And the results of your colonoscopy will be posted within 10 working days to your GP and the client. And if biopsies are taken during the procedure, the biopsy results will be sent back to the referrer, which will be the unit where you had your colonoscopy performed, within 5 working days of the result being obtained, but it might take a little while longer before the result actually gets to you. So this actually, I have 2 slides of the colonoscopy, so I'll just slip that one. A colonoscopy, it's a camera test of your bowel, and it will be done in a screening colonoscopy unit attached to a hospital. It will be organised by Bowel Screen, and it's free as part of the bowel cancer screening programme. Of the 6% that will be referred for, these are rough figures and they're based on international experience, so of the 6% that's sent for a colonoscopy, 50% will have a normal test, 40% will have polyps, and 10% will be a cancer. So you will have the colonoscopy done, you will need a bowel prep, and may or may not go for sedation. I certainly will be shouting for sedation. Risks involved, so the risks, it's an invasive procedure, and like every invasive procedure there are risks involved, and the risks increase if you have to have the polyp removed or if you have biopsy taken, and that goes with it. So people then who are deemed not suitable for a colonoscopy, some people may be referred on for a CT colon, which is a CAT scan or virtual colonoscopy, CAT scan of your colon. And some people are just not suitable. They might just have a lot of comorbidities, a lot of other illnesses, might have a poor tolerance or a failed colonoscopy in the past. And they will be sent for a CT colon. And this is a colonoscopy. You'll be on your left side, and just pass the camera into the back passage, up through your rectum, and it goes just up along, right through your bowel, and right to the cecum. So, and as you can see, the polyps, a lot of them are easily identified. Some of them can be quite flat and quite more difficult to see. So then some people then might just have the sigmoidoscopy done just to confirm if there is anything seen lower down in the bowel. So if the colonoscopy turns out to be positive, but if it doesn't turn out to be positive, you're just sent back to the screening program if it's a benign polyp. And if it's a malignant polyp, or the results go back as a precancerous polyp, a surgical opinion will be detected, and you'll be discussed at a meeting. And if your surgical opinion then within 10 working days, if you have a positive biopsy result, and you will remain in the symptomatic services for follow-up there, because you'll be in the surveillance program. If you have a positive CT of your CAT scan of your colon, if that is positive, you may require a colonoscopy, which you probably should have gone for in the first place, but you weren't deemed fit, or a sigmoidoscopy, which is just a smaller part of your bowel, because these could be people who would have a poor tolerance or a lot of other illnesses going on. Ethical issues then, just do the benefits of it outweigh the risks? Bringing in this program like that, it can cause a lot of anxiety. You visit a lot of anxiety on people whilst they're waiting for results. They didn't ask to go into the screening program. You were invited into it. So, but overall consensus that the benefits do outweigh the risks significantly. All the tests will be carried out to the highest standards. It will be continuously audited and peer reviewed against international standards, and there's a body set up for that. And it's just done there in 2012, early 2012, so that they can meet all their targets and keep their accreditation. And quality assurance will be done and continuous peer audit. So the take-home message really is the screening is for cancer in people with no symptoms. If you have symptoms, you go to your GP. It does not diagnose cancer, but refers you for further tests, in that it just diagnoses that you have stool or blood, microscopic blood in your stool. And if you have that, you will be sent on for other tests. So it doesn't actually diagnose a cancer. If experiencing symptoms, contact a GP. Do not wait for the screening. Many benign conditions cause blood in the stool, so I hope everyone won't go home thinking they have colorectal cancer. Avail of this service if you feel it's for you. And bowel cancer screening free phone is 1-800 45 45 55, and that is office hours. And the Irish Cancer Society helpline is 1-800 200 700, and I think that's office hours as well. So just avail of it if you feel it's for you. I thought that bowel cancer would be an interesting topic, especially with the bowel cancer screening programme coming on board. So just applied, say that, and asked my colleague Mary then if she would do it with me. So that's just basically how we got involved.
A family member died 4 years ago from bowel cancer. I recognise some of the treatments which my own father got when he was in hospital, and they talked about some of the prevention and the screening, which I mentioned, the second lady mentioned, is very interesting.
We were told by the organisers that it was one of the best responses that they got all year, and so it just goes to highlight the problems that people are having out there, especially we thought we'd have more of a response with the bowel cancer, but it's actually with the constipation and the laxatives is where we seem to have the bigger response. So just highlights the problems that are out there and how they need to be addressed, and maybe more focus on those problems, which is just common everyday problems for everybody.
I would. I think it's a great way for people to become educated. As I said, there's a lot of stuff going on in the paper. You can Google stuff, but you get sort of all sorts of inaccuracies. So going to Source, College of Surgeons, is probably a great place to get information. Yeah.
Certainly, just from the response we got there tonight was brilliant. Everyone's just so interested and just paid attention to what we were saying and seemed to take it on board. So definitely I think they are worthwhile, and they're free and they're for the public, and motivated people will come to it and people who want to learn more.